Psychiatry.
Yes, good morning there. I'm Dr. Maximo Gomez IV, applying for the Scramble Day Residency Training Program of 2019. I graduated in the University of Havana, and then from there I participated in some internship or observership in the United Kingdom and Glasgow, Victoria Infirmary. In 2001, I passed my USMLE ECFNG tests. Step 1, Step 2 clinical skills assessment, and at that time I was working at Columbia University, which is just a few blocks from this place. I am calling right now from New York. Now, a little bit about myself. When I get the certificate, I was accepted to a residency training program at Lincoln Hospital associated with Cornell at that time, and I completed some of the first year of the residency training, including rotations in neurology, internal medicine, some part of emergency room, psychiatry, and emergency room in medicine, including many of cases of rotations related to intensive management of cases. Now, this is the times of the compassionate agenda. These are the times where it can probably better described by one of the scripts in Hollywood of Will Ferrell. So I'm going to just attach this script so you can judge by yourself. Doctors come from everywhere in the world to practice medicine here as our pursuit of happiness. And one of the events, unfortunately, that very critical time of our history was the fact that there was a lot of uncertainty, and international factors were played also. Presidents know best, and the president was promoting compassion. This is a speech in July 1st, 2001, and I am immediately accepted into the same program to some way to lead by example to other doctors from everywhere else in the world. Here in New York, we receive doctors from virtually the whole world. Now, at this point, what I can bring to your project is not just my compassion, my professionalism, my experience. I believe I can bring a little bit more of the understanding of what's going on in terms of the community elements, in terms of the artificial intelligence that we have to start considering as a fact in the trainings, and the element of putting the biological and the psychological factors together with social elements that interfere or can affect the healthcare of people. So you're going to have a commitment, a doctor that is committed to help people and is committed socially in many ways to improve the delivery of the healthcare services, to decrease the cost, to improve the scientific excellence by simply bringing more pathology into the equation, and to make sure that we in some way prevent the kind of mistakes that have happened in the past. What I have done during these 15 years, well, the reality, I have been doing a lot of odd jobs. I have been working as a doctor in the ground, working to understand what's going on in the factories level with immigrants or with minorities there. The exposure to sometimes violation of OSHA, sometimes all the other factors that interfere, cold, poor labor conditions, things like that. So during these 15 years, I have been working in this kind of settings. And now I'm ready to go and finish my training, and I would like to respectfully request your leadership and your support to do this. So again, I am looking forward for this opportunity, and I am looking forward to serve and to become a part of your team, probably even better to use one or two of these extracurricular projects that I have to bring communities together in virtue of saving local costs for the local economies, the farmers or local business people, and it all comes with one single fact, which is the access to the hospital setting and the residency training where I belong. I hope to again talk to you soon, and I want to thank you very much for your support. See you soon.